is our next topic. Starting with ovarian cancer, the signs and symptoms are typically subtle, starting with bloating and pelvic pressure. Big NCLEX tip, I would write that one down. Bloating and pelvic pressure, as well as increased abdominal girth and urinary frequency with GI problems. Most ovarian cancers are diagnosed late because of the very subtle non-specific symptoms. Saunders mentions, educational class on ovarian cancer. Which signs and symptoms should the nurse include in the presentation? Select all that apply. Having urinary urgency or frequency. So be sure to know those key terms for ovarian cancer. Now for cervical cancer, the main key point is the causes. It results from cervical dysplasia, basically the abnormal cell growth within the cervix. The most highly tested cause was from HPV, human papillomavirus, big NCLEX tip, so write that down. This is the most tested cause of cervical cancer. HPV is an STI, that sexually transmitted infection. HPV is spread by skin-to-skin contact, even with condom use. So write that down. A lot of students get this wrong and think that everyone is safe with condom use. So key term is even with condom use, it can be spread. Now, vaccination before sexual activity is recommended for both boys and girls. Now, other causes include oral contraceptives, herpes, and smoking. So for risk factors, multiple sex partners, sexual activity before 18, as well as oral contraceptives that birth control, and even HIV. So Saunders mentions, which are the risk factors for cervical cancer? Select all that apply. Smoking, multiple sex partners, HPV infection, and first intercourse before 17 years of age. Now for the signs and symptoms, Saunders had a question about educational session on cancer of the cervix. The early sign of this type of cancer is irregular vaginal bleeding. So the key term is irregular vaginal bleeding. Now screening for cervical cancer includes a key term, Pap test, also called a Pap smear. This test collects cells from the cervix to check for abnormal cell growth. Now, the big key point for Pap smear is that it's recommended for women over 21 years of age, with sex or not, regardless of the sexual activity. So don't let the NCLEX trick you here. Not 17, not 18, 19, or even 20. The key number here is 21. And it's done every 3 years. Big NCLEX tip. Write that down. A Pap smear is recommended every 3 years, but only if there hasn't been any issues. Now, over the age of 65, Pap smear testing is typically discontinued. So Hesse mentions, which diagnostic test is useful for diagnosing cervical cancer? A papillonow test, fancy words for a Pap test.